Oh, crunchy.
Good. Now lift your chin up for me, okay? And rest your hips. Right there, okay? Good.
Hello everybody, my name's Madison. I'm here with Dr. Warren, the infamous Dr. Warren.
You're good, you're good.
Okay.
You're going, yeah.
Oh, okay, so today we are going to be showing you guys a video on tension headaches.
This is your
and how we're going to be, this is my 3-month review.
Yeah.
And how to fix them at home. A lot of people deal with this issue with tense neck muscles. You want to go elaborate?
No, it's good. I'm going to follow the lead. That was good. Good start.
Okay, go ahead.
Take it away.
I'm sorry, I didn't mean to make you nervous.
It's fine.
You just gotta step out of the camera. It's all you.
Yeah, it's all me. Excuse me, Dr. Warren.
So she's talking about tension headaches, and what I think a couple people every day come in probably with tension headaches. Probably see like 4 or 5 people in a day between the doctors with they come in with tension headaches or pain stemming from their neck, right? And do you experience those?
Yes, I do have those too.
Okay, and then what else do you have?
Migraines.
What are the difference? Well, how do we?
Migraines, I feel right in my frontalis, like right here, all the way from my occipitals, and then into my eyeballs.
Yeah, sometimes pain in the back of the eyes. Do you ever get any like any spots, any eye
you can get
visuals,
tunnel
auras?
vision.
You get tunnel vision as well.
Yeah.
Light
when they're
sensitivity.
really bad.
Yeah. Keep talking about it. I got to do something real quick right out here. Migraines are the worst.
Migraines, they're very debilitating. Most people have to lay down in a dark room. Sound can be very loud, like amplified. So
light sensitivity, irritation just to even normal noises. They feel like they're a lot louder than they are, and a lot of people that get them, they get them on almost sometimes on a routine basis. There's a time to them as well. Tension headaches are going to be a little bit different, right? And so it can come from stress, it can come from postural tension in the neck and the upper back, it can come from lifting heavy in the wrong manner that causes irritation to the neck, prolonged studying, sitting down, head forward. So
computer work,
definitely. And so you mentioned you had a little bit of a headache today, and I want to talk a little bit about chiropractic and soft tissue work for tension headaches. So one of the things that we see quite often, like I was saying, is cervicogenic headaches or tension headaches, and there's really good literature and support for doing some soft tissue work on there, and manipulation to the neck or adjustments to the neck, as well as postural stretches and exercises. And the big thing that we know when it's like, oh yep, that's a cervicogenic headache, is that we do a couple sessions and we see significant results right off the bat. Right? And so that is what we're going to start with today. Soft tissue work to begin with, okay? And so we'll work on the muscles of the shoulders and the trap, and we'll talk to Madison. Lovely intro, by the way.
Thank you.
Born for the camera.
I was ready.
So,
too close.
No, you're good.
Do you take any classes at all? Here, you can sit here and face that way.
Glasses? I do have glasses.
No classes.
No classes.
Drama classes.
Did you take the acting class at Towson?
No, not at Towson.
Oh my gosh, that was my favorite class.
University.
And are you in any movies?
I should be.
You should.
Excuse you, I should be.
Talent coordinators out there, please.
Woo.
Get this
reach
girl
out
an
to
agent.
me.
There you go. So we're going to work on the muscles of the shoulder that connect to the neck, okay? A couple of them in particular. So you have muscles that run the course of your spine that travel up into the neck, and then we have muscles that attach to the shoulder blade here and run the course of the top. So pinning and stretching out the muscles a little bit before we get started. So this is more the manual side of things in the office. Head back for me. Good. And head down. Head back. Good. And head down. Head back. And head down all the way. Take a deep breath in. And exhale it out. So you were in a video last week with Sebastian.
Yes. Which one?
The exercises for upper cross syndrome.
Yes.
Or just really postural tension of the upper back and neck. Those stretches would be very helpful, and that's on a previous video. Check it out. If you're kind of suffering from these type of chronic tension, neck, upper cervical headaches, right? Head back for me. Are you ready for our Oktoberfest?
Oh my goodness, yes, I just learned about this the other day.
What is it?
I'm on Dr. Warren's team.
Yes.
He recruited me.
I did recruit you early on.
Because
you probably burned like 6,000 calories just walking between each patient. Because I think you throw in a couple dance moves there every once in a while.
Oh, absolutely. You gotta keep it going.
And Madison's not outgoing at all.
No, I'm very introverted, boring.
Boring. You boring.
Kept to myself.
Bring your head back for me. Good. Head down. Hey, Madison, is this pressure okay for you?
Yes.
All right.
It looks like it feels good.
Feels amazing.
And so we're gonna work on. I'm happy for you. That's what I'm here for sure. Right ear to the right shoulder and left ear to the left shoulder. Good. And so Madison's journey is cool. She came in as a patient. Have we done a video before?
Yes, with Roman.
Oh, because you were behind the camera.
But I was behind the camera. You spoke to me for a little bit.
That's the truth. So you came in as a patient early on.
With lower back pain.
2021?
And cervical spine pain.
Yes, you did. And you were lifting a little bit more then, weren't you? Maybe.
Actually, the opposite.
Less then?
Yes.
Okay. But that's right. I met your mother, and she's really into the lifting.
Yes. Bodybuilder.
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 Yes.
Turn your head to your left. Tension headaches make you say words in weird ways as well. Madison's got that going up.
Sorry.
That's okay. Now keep it going. Turn your head to your right.
Oh.
Can you do both at the same time?
Yeah, absolutely.
That's fantastic. Good. So I'm palpating through, not like after I do a couple sessions of ART and where I'm getting the muscles to let go a little bit more, now she's relaxed, okay? And then I can go in and I can palpate the spine. So I'll show you how I motion palpate the thoracic spine in the lower segment as well as in the upper. So cross your arms like this. Perfect. And sit up tall, okay? And relax. There you go. Sit up tall and relax is kind of a hard thing to do, but you just did it. Nice job. And now I'm just going to move through the different segments of your mid-back. And I'm going to focus right in here when I go to work on you, okay?
That did feel a little, like, sore.
A little stiff. Yep. Those are the ribs. Hands like this. Go like this. Bring your elbows together. Good. And now fall onto my arm right here. That was my chest, but that's good. It's okay. You're good. Lean forward for me. And relax.
She just wanted a hug.
Dr.
Relax here. Take a deep breath. Easy. Okay. And exhale. Loose. Good job. So again, on that left shoulder blade and upper thoracic spine, I'm going to feel how our end range feels through extension. Good. Okay.
Thanks for that hug.
You're welcome. And now come face down for me. Madison, as you can tell, brings just a little bit of joy to this office.
Just a tad.
Just a wee bit. What are you going to do, Madison? Where are you going these days? Did you ever reach out? So my wife is a therapist, and she has a therapy company where it's mostly teletherapy. And I said, Madison, you bring a lot of joy to people's lives. Or just a little bit, I should say. you know. And you brought it up too, right? Talk therapy as a way of a career. It's an awesome career. But maybe nursing school?
Yes.
All right, so we're going to focus right here. You feel how that's almost, if I were to push on it, you'd say, hey, that kind of hurts a little bit. It hurts a little bit more than that side.
Yes.
So I'm going to work on these joints on the ribs right here. You'll feel some nice easy motion, okay? Take a deep breath in and exhale, easy. Good, now lift your chin up for me, okay? And rest your hips. Right there, okay? Good. Good job. Breathing?
Yeah, breathing.
Okay, so that's a fair bit of work. The soft tissue work on the shoulders, the adjustments to the mid-back, all right? And now I'm gonna focus on the joints between the shoulders and the neck. And so if we're gonna call it what it is, it's the cervicothoracic junction. That CT junction on her is just a little restricted on this left side. And it's just, think of it this way, when you go to a chiropractor, when you go to somebody doing body work on you, It's like going to the gym, right? And it's in a sense for the joint. So I'm trying to create better health around that segment. I'm not putting a joint back into place. I'm improving the function, the mobility, and the tone of that area so that she can go and do cartwheels down the hallway when she's going to get a patient. High five everybody in the morning like 30 times.
Oh, I was gonna high five you.
When?
In my hand.
So, sing people's names in the morning. Just a little bit of that. Just a little bit of joy coming at you. Watch out. Alright, and relax.
Oh, crunchy.
Good. Relax.
Oh. Wow.
Now I have to do a pause between each adjustment for you. Come on your back for me. So we're doing this video. If you are in the Baltimore area and you're suffering from cervicogenic headaches, I am happy to help you, period, right? And I think we do a good job of treating them here. There's a lot of different modalities we use. That was an adjustment, right? I do a lot of soft tissue work. We do what's called laser therapy, which is really comfortable, right? We do what's called dry needling. Depending on the person, depending on the problem and where they are along that journey and what they need, there's a lot of different therapies that we offer here.
Yay!
Okay. So last little bit, I'm going to take a look at the source. So I've kind of worked my way up the levels, if you will, on Madison and just giving her a full treatment of the back and neck, right?
Yes.
And so now I'm getting to those joints because she moves really well from here to here. It's a little higher up where I'm going to check where, when I've treated her before, where she can get a little bit restricted. So I'm going to let you feel what I feel a little bit here, okay? Let's walk through it.
Okay.
All right. So I'm going to let her head rest in my hands. And I'm really going to wait till she relaxes. Good.
Right, okay.
There, you're good. It's a little subtle thing. It's like from going from this to this.
Oh.
Yeah. And so then from there, I'm going to take those joints and I'm going to feel how they're gliding in this plane, in this plane. Don't love that for you. I want to change that for you. So a little restriction going in rotation and extension on the right hand side. And then lateral flexion. So I'm going to couple all those motions. And it's not a ton of motion at that space. But if I push here, you'll say, And if I push here, you'll say, Because, what do you feel here relative to that? You tell me.
Do it again.
Sure.
I feel pain.
So the muscle, the suboccipital muscles on this right hand side, definitely a little bit tighter over here, as well as the joint just underneath my finger. It's your occipital joint is restricted. So I'm going to work those small, tiny little muscles first. Go. And this is a different sensation than, say, the shoulders or the hands. There's a ton of sensory neurons right under the tip of my finger here, and you feel a lot here. We don't really get a lot of pressure here, but our body has a lot of feedback because of the joint level, okay? It gives us a lot of information about where our head is in space. And so some chiropractors actually just work on that joint alone to try to create a little bit more of an effect on the body. That's not what we do here. We work on the whole spine, but it just goes to show you how powerful that segment can be for helping people. So we're gonna get into it now. Okay. Grab my soft tissue cream. Oh, this video series.
Hans Honey.
That's it. Say it one more time.
Hans Honey.
Yes, Hans Honey. Baltimore, Maryland-based company.
Smells delish.
Smells very good.
It does smell good.
It's an amazing cause, but they got good products off the bat. We can talk about their cause on another video, but Hans Honey, shout out. And we'll put that up there perpetually going forward. There's a link, you can go onto their website, support their cause, as well as get some of their products for some soft tissue work of your own, or just for your hands, because it's good for your hands. Alright, so get around your cool earrings here, and I'm gonna pull you across here. Nice and easy. I'm gonna hook onto that small little muscle right there. And we're gonna stretch. And breathe. Good. And I'm gonna be very mindful that I'm not pulling on your hair as best I can. You let me know if I am.
Fine.
Good. So those muscles that sit underneath the occiput and attach to the first and second level of the neck, they mostly just turn your head. A little tilting side to side, but mostly just turn. Turn left. Now relax. Breathe. Easy. There you go. You made a noise? That muscle did?
Yeah, did you hear that?
Yeah, I heard the talk. That was wild.
Said, what's up?
What? Whoa.
That was silly.
Andrew, you come in.
I'm just getting trashed.
Oh, yeah, man.
I don't want to do that.
You could have got it. That's okay. Andrew is the head of our strength program. We'll introduce you to Andrew later on. And Sabrina, and Rachel, and Michael. We got 4 awesome trainers out there. And then these guys here, Addison also floats over there and does her thing from time to time as well. And we appreciate you for that. Okay, let me see this jaw open for me.
I know. It popped out of place the other morning. I was freaking out.
Slowly open it. Close it. Slowly open it. Close it. Do you get jaw pain?
Oh, yeah.
That's one joint nobody really proactively treats, I feel like, enough. With cervicogenic headaches, it's the TMJ joint. Temporomandibular joint. So with people with jaw pain and neck pain and headaches, you gotta kind of work on both angles of things, and even I would argue into the shoulder is like the biggest area, the culprit of things, and stress. Those are the 2 major problems I see with it. So we're gonna do a nice light adjustment here to her neck. Let this go for me. Good, and it's easy and release, okay? There you go. Good, a little quicker. Good, moving fine there. All right, now you're gonna turn your head to your left. Good. And so I always will, especially with neck tension like that, I'll go to the side she moves well to first, and now I'm gonna go to the segment that I was feeling restricted on the right-hand side. Good.
Oh!
Good?
Good, yeah.
Yeah. A little quicker, all right? So that's why the quick thrust.
Quick little 1-2.
Boom, boom. How are you doing?
Great. That felt wonderful.
Nice. You deserve it. I appreciate it.
Thank you. That was so relaxing.
Yeah. This is, like I do from time to time, this is my time to show my appreciation to the staff in here when we do the staff videos. We do patient videos as well, but my schedule has changed, so I've been a little busier lately. It's hard to get those patient videos in, but I appreciate you.
Appreciate you. Should we do our handshake? Remember that? No.
Oh, I totally forget it, but I'm gonna run with this. Is that it?
That's what I remember. He was like,
I thought we had.
be sick.
Thanks for watching. Madison, thanks for introing for us.
No problem.
You're the full-time intro person now.
Okay.
Done.
Done. Deal.
Peace.